We knew that we had to start giving full-scale medical care, and finally we rented a church parsonage and turned 2 rooms into examining rooms and the kitchen into a lab and the living room into a waiting room, and just started. And people did what they always do. They sent scouts. The first day about 5 people came. The second day about 15 people came. The third day about 60 people came, because the word had gone out that this was helpful and an attempt to be decent. And after a couple of weeks, we sat down with some of those folks and said, we want to find out from you, how is this working? How is the medical care? And what do we need to be doing? And they said, oh, the medical care is wonderful and we're really appreciative of it. Well, we wonder if you couldn't do something about the fact that we don't have anything to eat, and it rains through holes in the roof and freezes in the winter, and the kids don't have any shoes so they can't go to school. You think you could do something about those things? Really, why we had come in the first place. But the problem is, when you start meeting overwhelming needs for health care, you can't have neither the time nor maybe the focus to do much beside that, and to start to concentrate on ways to intervene in these community-based causes and make the kinds of changes that will affect the present and future generations, but also make people healthier.
The 2 most powerful organizations were churches and then benevolent societies. And the primary function of a benevolent society was to take care of people in crises and to bury the dead. Both these structures were highly organized, with some people on the top and some in the middle, and a lot of soldiers out there to carry out the marching orders of the higher up people. Well, my goodness, you know, you'd say, what a wonderful structure, but can you get these folk to buy into the notion of community health? And will they participate in the various kinds of activities like sanitation and environmental control that we see as important to benefiting the health? And of course the answer is yes, indeed, they did. One of our most significant educators was not a literate person, but he could take drops of water, place them on a slide under a microscope, and show them to the community, and people say, I don't see a thing. And all these things crawling around under this microscope, and they can get you. And then this man who is not literate would tell them how to kill those things. Those were magical moments, and people would sometimes line up as if they were going to a theater.
We were, all of us, I think, in those early years, really about social change, whether it was urban or rural or migrant or public housing or whatever. And health was a very immediate and real way in, and it was very useful because the idea of health and health care had meaning to people. It wasn't some abstraction and remote. And on the other hand, beside being salient to the people you were trying to work with, it had sanction from the government or from the larger society or from local power establishments.